Chair recognizes Senator Sanders.
Thank you, Mr. Chairman. Dr. Galvani, you and your colleagues at Yale and the University of Pennsylvania have estimated that 51,000 people will die each year as a result of this reconciliation bill. How did you come up with those estimates?
Our estimates are based on the congressional budget calculation that 17 million people are poised to lose health care. We can then compare, from empirical studies, the rates of mortality, age-stratified mortality, for people who are insured versus uninsured. There's about a 40% higher rate of mortality for those people, and that's how we generated that number. In addition, the University of Pennsylvania calculated the impacts of changes to nursing home safety procedures and the removal of pharmaceutical subsidies for seniors and Medicare.
Okay. A moment, I'm sorry he left. Senator Husted thought that this legislation would be a positive for rural hospitals, quoted a statement from some folks in Ohio. The University of North Carolina has estimated that this legislation will cause over 335 rural hospitals in America to shut down or substantially reduce the services they provide. Mr. Weissman, what is your sense about how this legislation will impact rural hospitals throughout the country?
Although I'm from Ohio, I don't know what that reference was, but I think the best evidence is it will be devastating for rural hospitals. And the $50 billion was about a third of what's going to be lost overall for rural hospitals from the bill. I think what you just said is really important. A significant number will close. Others that stay open will massively scale back the services they offer. And as we know, what that means for people in rural America is that they're going to not get access to care. Often the rural hospital is not just one of many hospitals, is the one that they can go to, and the choice is to not go at all. There are also economic linchpins and community centers. We're going to see really the de-atomization of rural America worse as a result of this Medicaid cutback.
Okay. Ms. Stevenson, I know that you're not the CEO of your hospital. Do you have any thoughts about the impact of the reconciliation bill on rural hospitals?
Certainly, we are spending a lot of time doing evaluation of that right now because it's so recent. I don't have any details. However, I can tell you that any cuts for organizations, if that were to arise, depending on how that's appropriated throughout the states, it means fewer dollars to invest in, whether that's for patient care or it's for cybersecurity. So more to come, but we are certainly watching it closely.
Thank you. Dr. Galvani and Mr. Weissman talked a little bit about rural hospitals. We talked about the impact on primarily low-income and working-class people who will lose their health care. According to a recent survey, 27% of nursing homes in America, and that's just an issue, Mr. Chairman, we don't talk about enough. I could tell you that in Vermont, nursing homes are struggling, but this bill will make that situation even worse. There are estimates that up to 27% of nursing homes indicating that they will be forced to shut down, and 58% are reducing their staff as a result of the bill. Anybody want to comment on the impact of this legislation on nursing homes? Rob?
Well, as you know, Medicaid is how most people pay for nursing homes. Medicaid also provides reimbursement to people for Medicare costs who are living in nursing homes. That's going to be restricted. I know this from a personal experience. Many of us do. Nursing homes provide crucial assistance for people in their later years. If they can't go, which is what it means, there's incredible suffering that's going to take place and intolerable burdens on the families as a result.
Okay, well, thank you very much.
Well, among the half-truths being promulgated, the nursing homes are carved out of this legislation, so I'm not sure how they're going to be affected. That said, let's go with some real
No,
truths.
Mr. Chairman,
No, I'm sorry, I got the
Come
gavel.
on.
No, I got the gavel, Bernie. This is about cybersecurity. Thank you all for those